Wagwan, everybody. I am your Jamaican queen, Miss Y. You are tuned into How I See It TV, and this is Accurate Context. This video may contain copyrighted material. The use of such material is for criticism, commentary, news reporting, teaching, scholarship, or research and falls under fair use provisions of Section 107 of the Copyright Act of 1976. Married to Medicine, aired on the Bravo Network, is the first and only show that showcases Black doctors and other medical professionals. You would think that with two of the professionals on the show being Black OBGYNs, LaTeasha Lunceford being brave enough to share her story of being diagnosed in the early parts of 2023 with endometriosis, she would have received more support from the doctors as Heavenly took to her YouTube to spread misinformation about LaTeasha's reproductive health, especially her endometriosis diagnosis. You would also think that Dr. Jackie would want to put advocacy into practice by educating her BFF Heavenly on what endometriosis is and how it is actually diagnosed. But should we expect advocacy from Dr. Jackie when she said this?
Sometimes, as African American women, we're a bit more dramatic in that you go to the doctor and you complain and you complain and you complain, and you're not taken serious because you cried wolf the entire pregnancy.
That ain't me, boo. I don't know what you're talking about, but go ahead.
I didn't say you. I just said as African American women, we want to also make sure you're being serious with your doctor and not playing the game so I can take you off work. Because then we see you 25 times in the pregnancy. It's hard to believe that there's a true problem when there's a true problem.
And as you should know, Dr. Jackie, and what you should have been telling your BFF Heavenly, is that true reproductive health issues start long before conception, with many women being misdiagnosed or going undiagnosed until they start trying to have a baby. So now let's get into some of Dr. Heavenly's nasty commentary about LaTeasha's reproductive health.
Bleeding and hurting. Now, I don't know when it started, but it couldn't have started this year. That's my question, and that's my drama for the show. You had to have been on there. We get pap smears all the time. There's no way you could tell me that my walls of my uterus are falling, and bitch, I didn't know it. Come on now, don't do this season, this year, because honestly...
Now, Heavenly, maybe because you are a dentist, you would not have known that endometriosis cannot be diagnosed through a pap smear. But you don't have to take my word for it, because after all, I'm not a doctor either. But I'm going to let y'all listen to an actual OBGYN tell us how endometriosis is actually diagnosed.
How do I know that I have endometriosis? The issue with endometriosis is that we can't officially diagnose endometriosis unless we go in to do a laparoscopic surgery and actually remove some of the tissue, send it to a pathologist, and that pathologist tells us, yes, this is endometrial tissue.
So instead of using your platform for good, Heavenly, to spread more awareness about endometriosis, you decided to be messy and utilize your platform to tear a woman down. How disgusting. Now, I would like to read from an article entitled Endometriosis: Black Women Continue to Receive Poor Care for the Condition, published in March of 2023 by researchers from the University of Oxford, Birmingham City University, and the University of Manchester. And in the article, it states that sufferers of the condition endometriosis wait between 8 to 12 years on average for a diagnosis. Yet, for Black women, this picture is even worse, with research showing they are 50% less likely to be diagnosed with endometriosis compared to white women. There are a number of reasons for why this is the case, including barriers to gynecological care and systematic racism in the medical field. But this means that Black women may suffer for many more years as a result without a proper diagnosis or treatment. The article goes on to state that racial disparities in pain treatment are also found in endometriosis care. In the UK, women with endometriosis from minority ethnic groups are less likely to have their pain believed by clinicians. In the US, almost 72% of patients diagnosed with endometriosis are white and only around 5% are Black. This discrepancy is staggering, especially considering there's no definitive evidence endometriosis is more common in white patients. The minority of Black women who are diagnosed with endometriosis are diagnosed on average 2.5 years later than white women. Black women are also less likely to receive endometriosis surgery, and if they do, are more likely to experience surgical complications afterwards. The underdiagnosis of endometriosis in Black patients was first identified in the 1970s. Despite this, we still have no reliable estimate of how common endometriosis actually is in Black women. This is due to an absence of quality research and the persistent misconception that endometriosis is a quote-unquote white career woman's disease and is rare in patients of color. But since Heavenly doesn't believe Sweetie's story, maybe she will believe white women who have the exact story that Sweetie presented on Married to Medicine and in her interviews.
I just got my first period. Mum says it's a part of becoming a woman. Soon I realized it's not so simple. At school, I'll get such bad cramps. I'll often cry in front of my classmates, but I'll be dismissed by teachers and school nurses. It's just bad period pain, they'll say. When I'm 18, I'll go to the hospital, feeling like my stomach is being ripped out. They'll just send me home with Nurofen. It's just bad period pain, they'll say. In my 20s, I'll have surgery 3 times. I'll just get by at uni, because every month I'll be curled over on the shower floor as though my pelvis is being torn out.
I'll be let go from my first job, as just bad period pain is not an excuse for sick days. And when I'm 30, I'll try for a baby. 2 years later, I'll still be trying. Endometriosis is not just bad period pain.
Bleeding and hurting. Now, I don't know when it started, but it couldn't have started this year. That's my question, and that's my drama for the show. You had to have been down there. We get pap smears all the time. There's no way you could tell me that my walls of my uterus are falling, and bitch, I didn't know it. Come on now, don't do this season, this year, because honestly,
Heavenly, because you are just a dentist, you might not know that endometriosis has more to do with just your quote unquote walls of your uterus falling out. But don't take my word for it. Let's listen to what this doctor has to say.
Often as doctors, we don't join the dots. And so we do have to realize that endometriosis is a whole body condition. It's a chronic condition that causes endometriosis belly, it causes bloating, it causes chronic fatigue, it causes bladder symptoms, bowel symptoms that people think is irritable bowel syndrome when actually it's not. So it's really important that not just women, but all of us raise awareness.
Did she not know last year? Did she not know the year before?
Well, Heavenly, maybe if a non-Black woman tells the same story as Sweet Tea about how long it took doctors to finally diagnose her symptoms as endometriosis, maybe you'll believe this non-Black woman.
Endometriosis wreaked havoc on my life. It took years and years and years to finally get a diagnosis. I remember not being able to function. It was the type of pain that kept me in bed all day. I went to doctor after doctor after doctor. I was told by every single doctor I went to, dozens, that my periods are normal, that pain is normal and discomfort is normal, that I just need to take medicine. I was prescribed all sorts of things and the pain was not getting any better. I was almost made to feel like I was making up my symptoms and overreacting. This was something that was very painful physically and also emotionally because my pain was never validated. I knew something was wrong with my body. I felt like there was no way out of this cycle of absolute pain and isolation until I finally got a diagnosis. I know
you had to have been on there. We get pap smears all the time. There's no way you could tell me that my walls of my uterus are falling and bitch, I didn't know it. Come on now, don't do this season, this year. Did she not know last year? Did she not know the year before?
Well, Heavenly, since you don't believe Sweet Tea's story, perhaps you believe a white male doctor as he explains how many years on average it actually takes for endometriosis to be diagnosed.
Do you know it takes on average 7 to 10 years for a woman to get a proper diagnosis of endometriosis? Well, I think this is due to two reasons. First of all, endometriosis runs in families. When a young woman complains to her mom, gee, my periods are terrible, they hurt, she goes, that's the way they are, because that's been the mother's experience, maybe even the grandmother's experience, and it's just assumed to be normal. Second, doctors have now improved their knowledge of endometriosis just recently over the past 5 to 10 years. Endometriosis is a lot more common than people think, and the symptoms were just blown off in the past and they weren't properly appreciated. So realize that your doctor may also not be up to speed.
More than a dozen physicians repeatedly told me that my ultrasounds looked normal, to just take pain medicine, to get more rest, or that my period symptoms were typical for a woman, making me feel like a true drama queen. This attitude toward me persisted for years, to the point that I began to question my own sanity. Imagine waking up tomorrow morning, feeling inexplicable pain that worsens, and the cause won't be diagnosed until 2033. The average wait time for a diagnosis of endometriosis is 10 years. That is our reality, and that needs to change.
So I don't know if women, I'm aware that you're supposed to go see your OBGYN on an annual basis, right? I am aware of that. And that typically when you do that, they can discover things that's happening. So again, I'm not here to self-diagnose, Sweet Tea. I wanted to know because I'm not a woman. I don't have ovaries. I have a hook and a curve. So because I'm a man.
Right.
So that's the reason why I wanted to point the question to you, because it did appear that, okay, is this scene genuine? And then it was also one of those things where we just wanted to know, like, And again, color me ignorant. I'm not a doctor. That's why I love talking to you, Dr. Hemley. Is it uncommon for a woman who wants to have kids, tells a man she wants to get married, not check to see what's going on with her before they say I do?
I have several issues with the clip that y'all just saw. One, why is a man, Carlos King, speculating about a woman's reproductive health? And two, why is he asking a dentist who does not have the bandwidth to explain reproductive health conditions about LaTeasha's diagnosis? But perhaps superstar rapper EVE explaining her journey of knowing that she did have fibroids, just like Sweet Tea, but only finding out that she had endometriosis after she was married and now trying to have a baby. Maybe this will help y'all believe Sweet Tea's story.
You were diagnosed with endometriosis and fibroids. Did you have any idea how that would affect your fertility?
No. Back then it's something nobody really talked about. Doctors barely even talked about it. I mean, I always had painful periods, but that's also something that they tell women. So I never thought anything of it. And I also never thought that I had to hurry up and have kids because I was like, I'm gonna fall in love, I'm gonna have kids. And it just didn't happen like that. And I had to go to a specialist, and she was the one that was like, yeah, you have like 14 fibroids. You have to have surgery to get rid of this. So.
And Carlos, if Dr. Heavenly was actually qualified, then she would have been able to explain to you that there are many cases of women who don't develop endometriosis until after they have conceived and they have delivered a baby, especially through C-sections.
I'm kind of still thinking about how everyone tried to gaslight me into thinking that all of my issues were just because I've had 2 kids and they were both by C-section. That's normal. It wasn't. And even the endometriosis specialist that I met with over Zoom told me, yeah, it's not. You don't have endometriosis. And then a month later, I had a laparoscopic surgery done somewhere else. They did the biopsy and confirmed endometriosis. So yeah, the fact that it hurts to cough and pee and sit at a 90-degree angle, so like on any chair, like this is painful right now, sitting in my driver's seat of my car, that was not just because I've been pregnant. I have endometriosis all over my pelvis and on my ureter. It's so fun. They told me to go to pelvic PT, which I did because I'm not against trying things. And I did all the exercises, but you can't exactly exercise away endometriosis. And mine is severe. So there's that. It's so frustrating. I don't even know what to do anymore. The best part is when you find out you have it, they're like, that sucks because there's no treatment. I'm kind of still.
Did she not know last year? Did she not know the year before? I'm not talking about the girl because she gonna retaliate, but her body looked like a 67-year-old. You see what I'm saying? Like Quad got body, Toya got body, everybody got her body. Look, I'm not body shaming. I'm just.
How insensitive is it that you would know that this woman has endometriosis, but you sit on your platform and body shame her in front of thousands of your supporters on your YouTube live, instead of bringing awareness to the masses of how much a woman's body actually goes through, including the physical changes, because one of the symptoms of endometriosis is an endobelly that a lot of women feel self-conscious about. How disgusting.
This is the side of endometriosis that I don't think many of us share enough. As you can see right now, my endobelly is so extremely inflamed. I'm struggling to breathe. My back is hurting. It is the #1 symptom that we need awareness for.
And now for these next clips, if you are a woman who is struggling with fertility issues, Trigger warning, because these clips are very
My
insensitive.
quote is, I'm 52 years old. I got a better chance of getting pregnant than she do.
Instead of having quad on her vision board, she should have had, some eggs and some babies.
My quote is, I'm 52 years old. I got a better chance of getting pregnant than she do.
Women can get pregnant when they have endometriosis and PCOS, or just PCOS, or just endometriosis. It really is more of a function of are both adequately treated. Even women with endometriosis can get pregnant. In most cases, it's best if we can control their endometriosis prior to them getting pregnant, because some of the inflammatory mediators in endometriosis oftentimes impact infertility, which is why so many people with endometriosis have infertility, even if their tubes are open. So many people come and talk to us all the time and say, hey, my tubes were open, but I do have endometriosis. What should I do? And the answer is treat the endometriosis. If you have polycystic ovarian syndrome, usually that becomes an ovulatory dysfunction, meaning that you just don't produce an egg appropriately. And that can be treated with medication, and there's a lot of other mechanisms that we can treat that. So if you have endometriosis and we control the endometriosis, and then you have polycystic ovarian and we give you medicines to help you ovulate, you should be able to get pregnant.
I have endometriosis and I'm also currently pregnant with my first child, and believe it or not, those two things do go hand in hand. So I actually fell pregnant with my little girl in August after trying for a couple of months without success.
Then you've gone on to have a son through IVF.
Yes.
Some of the doctors on Married to Medicine, specifically Dr. Heavenly and Dr. Jackie, act as if the other women on the cast who are not doctors are beneath them. On Watch What Happens Live, Dr. Jackie even said Sweet Tea should apologize for being around. They treat LaTeasha as if she is not a college graduate. They act as if she's not an Air Force veteran. They act as if this young woman isn't currently an employee of the federal government. They act as if she's not an adult with life experiences, a whole wife, a human being. They want to bully her into silence and excuse all of Dr. Heavenly's bad behavior, excuse all of her vile statements regarding Sweetie's reproductive health. The statements that Dr. Heavenly has made about this young woman's reproductive health has caused hundreds of strangers to leave comments accusing LaTeasha of lying to Dr. G and trapping him in a marriage, even though she knew before they met that she had infertility issues, even though this young lady has said on several occasions that she only found out that she had endometriosis a month or so before she was married, and her husband was very much aware of her fibroids when they met. And what a lot of people forget is that LaTeasha told us during last season's reunion that Heavenly was her dentist. And even though Heavenly did not disclose any of LaTeasha's dental information, Heavenly still was privy to certain medical information, which means that she had an obligation to LaTeasha as a medical professional to not do any harm. And a lot of the things that Heavenly says on her YouTube regarding LaTeasha's health, the body shaming as well, that's harmful. And if Heavenly was truly an advocate for women's reproductive health, then she would have informed her fans that having fibroids does not make you infertile. Dr. Heavenly's nasty comments about LaTeasha's reproductive issues should have excluded her from this trip to the White House last year for an informative session discussing reproductive freedoms. Let's read Dr. Jackie's caption. Reproductive rights are about the legal right to contraception, abortion, fertility treatment, reproductive health, and access to information about one's reproductive body. Reproductive rights secure people's freedom to decide about their body's capacities to not reproduce. There was so much information shared by our then VP and others. We are grateful to be a part of the change we want to see. What change is that, Dr. Jackie, when this year Heavenly sat on her Patreon, still taking digs at LaTeasha's inability to conceive at this particular time. This is how we know that this trip to the White House was performative. It was not about true advocacy, because advocacy includes education. Advocacy is also about holding your counterparts accountable when they do the things that Heavenly is doing to this young woman. But thank God for doctors like Dr. Hawkins of the Fibroid and Pelvic Wellness Center in Georgia, who is working every day to create more awareness about endometriosis. A doctor who is ensuring that women, regardless of their status, have access to a safe place where they can receive care for their chronic reproductive illnesses that for most Black women goes misdiagnosed or untreated.
Endometriosis patients should have access to surgery and pelvic pain specialists. This is why my practice, the Fibroid and Pelvic Wellness Center of Georgia, is committed to staying within the reach of insured patients and providing resources to the uninsured women to receive financial assistance so that we can perform their surgeries. It is important to me that I offer my patients the best in surgical care, expertise in excision techniques, and excellence in developing their healthcare community that can help them navigate this chronic disease forever. This is simply what they deserve. Each patient I encounter is a reminder of my journey and the need for advocacy, the need for change in policy, and the need for representation in the world of science.
Endometriosis Awareness Month comes up in March. For more information on endometriosis, follow Endo Black Incorporated on Instagram and TikTok. You can also follow Endo Speaks or follow LaTeasha Lunceford as she continues to share her journey. I thank you all for watching. Drop some yellow hearts in the chat because that is the color for endometriosis awareness is yellow. Please remember to like, share, and subscribe. And until my next video, walk good. Bye.